am going to be talking about my intervention research project called Overdose Prevention Champions, which is an intervention to train non-drug using friends and family of people who use opioids to provide them with social support around accessing harm reduction tools and services. I developed this intervention in response to the fact that the opioid overdose crisis has been disproportionately affecting older Black men on the west side of Chicago for the past several years. In 2024, Black men over the age of 55 comprised almost a quarter of opioid overdose deaths in Cook County, and a large proportion of these deaths occurred in predominantly Black neighborhoods on the west side, including Austin and West Garfield Park, where my study is taking place. And trying to understand the factors driving this health disparity in order to help address it, if we think just about the geographic disparities and differences between neighborhoods, we could attribute those largely to differences in communities in structural and economic disadvantage. However, if we're trying to think about why older adults in particular are being disproportionately affected, we need to think about social factors that we know are related to both older age as well as to overdose. And those include social isolation and substance use-related stigma, both of which we know are higher in older age cohorts and also related to overdose. So I developed the Overdose Prevention Champions intervention to address these underlying social factors, and I obtained CDC R01 funding to conduct a quasi-experimental study to test the intervention. Our intervention participants are going to be recruited from churches in Austin and West Garfield Park because we know that churches have older populations on average that are people who are well socially connected on average. And from those churches, we're going to recruit people who don't use opioids themselves, but who know and care about someone in their life who does use opioids. And then we're going to provide these champions with video-based education on substance use disorder, substance use-related stigma, and on specific harm reduction tools and services like fentanyl test strips and naloxone, and also education on where to access those and how to use them correctly. And then we'll also ask these champions to recruit to the study the person in their lives who uses opioids, and we'll invite them to join the study as well, and we'll provide those people with the same education and resources, and then we'll ask both members of these peer pairs to meet together with a licensed mental health counselor and develop a plan that works for both of them, in which the champion will provide social support related to accessing harm reduction services to the person who uses opioids. In terms of how we expect this intervention to work theoretically, we expect that the intervention, which is depicted on the far left, we expect it will directly increase knowledge about substance use disorder and harm reduction, and that it will also directly decrease substance use-related stigma among our champions, as well as directly increase harm reduction-related social support among our participants who use opioids. And then we expect that all of these mediating mechanisms will in turn serve to increase frequency and consistency of access and utilization of harm reduction services among our participants who use opioids, and that this in turn should reduce risk for overdose. So we are in the very early stages of recruitment. We have over 100 churches in Austin and West Garfield Park who've agreed to allow us to recruit participants from their church services, and of those we've only done recruitment in 3 so far. So we're in very early days, but I will keep the UIC community posted on our progress and findings. Thank you.